at this point, I'd like to move away from the abstract stuff and give a nice concrete example. So to do that, I'm going to hand over shortly to Victoria Palmer. Victoria works at CARE Canada as a humanitarian meal specialist, and she supports CARE's humanitarian projects funded by the Government of Canada and contributing to CARE's global approach to meal and humanitarian programming. She's originally from the UK, and she's been working in the humanitarian sector for over 10 years now in a variety of different meal roles, including 3 years on Save the Children UK's emergency response team, and also working as a consultant for various organizations. So Victoria, it's great to have you with us. I'm really excited to hear about your rolling profiles. There's a lot in the content that you're going to share with our audience. So I wonder if you could start just by saying hello to the audience so that we can all hear you.
Hi, I'm here.
Great, thank you for joining us. And maybe you could kick off by giving us a brief overview of the rolling profile methodology. So what is it, and what does it look like?
Thank you, Neil, and thank you for inviting me to speak. So the rolling profile methodology is an approach developed by CARE Canada for our development projects, and it's something I've been looking into and thinking around how we could adapt it for humanitarian programming. So it's a qualitative approach to monitoring outcome and impact, and we have applied it on specific projects in the past. The reason we say rolling is because you start collecting data and carrying out this cycle of systematization and analysis and sense making. You start at the beginning of the project and then you repeat it every 6 months throughout the project. And profile comes from the fact that it's mainly consists of doing a case study with individual beneficiaries or project participants and other stakeholders. So it's really looking at that kind of individual in-depth qualitative understanding of their experiences. But it's not just a case study looking at what's gone well. The idea is that you're looking at what has changed for those participants. And it could be things that have changed which have gone well, or it could be things that haven't changed that we were hoping would change, or negative impact that we weren't expecting to see. So it's trying to look at why that's happened and how that's happened. So the idea is that you structure your data collection, your analysis against these predefined domains of change. And you would define those by looking at your project theory of change or your logic model and looking at what needs to change for you to achieve the outcome or the impact that you're aiming for, and who does that change need to happen for. So you can see on the screen there an example from a women's economic empowerment project, and these were the domains of change that they defined. And this structured the way that they collected the data in terms of the different areas that they were probing, and then how they did the analysis. And they wanted to see change in all of these domains in order to achieve the goal of the project. So that's a very brief overview of the methodology.
Fantastic, thank you for doing that. There's a lot in there. It's really interesting stuff. So I think it's quite a few different things to unpack. I wonder if you could start by just telling us a little bit more about the data collection approach that you're using for this. So how did you gather all of the information that you were gathering from project participants, and what types of methodology did you use?
Yeah, different things that we consider in the data collection. First of all, we limit the number of participants or people that we speak to as respondents. So the first thing to do is to figure out who to speak to, and that relates again to those areas of change. So it's who in the project, who are the key stakeholders and the key beneficiaries that you think need to change in order to achieve what you're aiming for. And you can see there a list on the right where it says rolling profile participants by type. There are different types of people within that. So obviously you want to speak with your beneficiaries, and there might be different categories. You can see adolescents, women of reproductive age. So you break them into different groups, but then also there are other people that you're working through. We might call them intermediaries. For example, community health workers or volunteers, community facilitators, the people who will be delivering services and who you're probably going to be strengthening the capacity or trying to increase their skills. So it's also important to speak to those different types of stakeholders. So that process in interesting, identifying who you're going to speak to. And then we would look at speaking to at least 5 people in each of those groups. So it's quite a small sample size. It's usually around 20 to 30 people that you're speaking to in total, because you pick those people at the beginning, obviously depending on their interest and their availability, and then you'll go back to those same people every 6 months, looking at what's changed for them as a result of the project or what's not changed. So the staff who go and do the interviews will be conducting these in-depth interviews and also using observation. What we found in our experience on the development side is that it doesn't just have to be M&E staff who can do these interviews, but it's also something that can be, you can encourage other staff members who are interested and who have the right skills to get involved. So you might have maybe senior managers or technical staff getting involved and crucially going back to the same people each time to build up that relationship. And that really can help to increase people's buy-in and interest in the data that we collect. So the example there you see in blue, those are the kind of areas for discussion in those interviews. So this is an example of a discussion guide which people would take to the field with them, and the idea is that staff are trained very, very well at the beginning to be very familiar with the areas of change that they're looking to probe, and instead of writing down specific questions which could limit the kind of openness of the interview, they just go with these prompts of different areas of change that they're looking for. So there really has to be a big emphasis on building capacity of the staff to be comfortable conducting this kind of qualitative approach, which can be quite challenging. So they're really looking to touch on these different areas and probe where they see that changes are happening or changes are not happening, and trying to find out why and what the different factors are. So I hope that answered your question.
Yeah, it does, very comprehensively. That's a good breakdown of the data collection stuff. I guess once you've done all of that, you're going to be gathering quite a broad range of information. So I'm keen to understand how you handle the breadth of information that you're collecting with this methodology. How do you go about systematizing it and turning it into something you can make sense of?
Yeah, so this is really important. This is the next step. You get all of this information. Obviously, with qualitative data, you have a lot of data that you've collected. It's not, just a case of ticking a box. There's a lot of information to be written down. So the first thing is for the staff who've collected the information to write down everything, write up the interview. You can see an example there. And then they'll go through the write-up and tag different statements according to those areas of change that were defined at the beginning. So you can see in the example something's been underlined and coded. They can use highlighting, basically just looking at everything that they've seen and deciding which statement relates to which area of change. And then they need to enter those statements into the analysis framework, and you can see a small example on the screen. It's basically an Excel spreadsheet where they write in the statements for each of the people that they've interviewed and just code them according to those different categories. So that step is fairly simple, but obviously it takes time and it needs to be done well so they can lead into the analysis.
Absolutely. So, I mean, you've touched on it there. Once you've done that and you've got something that kind of is sense makeable, what happens once you've done all that work? How do you go about analyzing the data that you've gathered?
Yeah, so for the analysis, there are several different ways to look at it, and some projects would do all of them and some would choose particular approaches. I mean, the key thing is, like for any analysis, it's looking for the key trends and patterns that you're seeing, and because we've got this kind of longitudinal approach, you're also looking for changes over time. So you can take an individual person and look at how things have changed for them over time, or you could look at one of those domains of change and look at the key things that have changed or not changed. But what's really interesting is that you can also do a comparison across those groups. So you could look at what's changed for women and then what's changed for men and what's changed for health workers or what's not changed, and compare how things are changing within those different groups. And I think it's really exciting because then you start to build up a picture of why things aren't changing. So for example, if we hadn't seen the change we hope to see with health workers, has that then impacted on the change we were hoping to see for women? So you really start to get that sense of what's going on from different perspectives. For CARE, we're a women's empowerment organisation and gender equality organisation, so we'd also always apply a gender analysis in what we're looking for, as gender is one of those key areas of change for us.
Sure.
And then another really interesting area is using progress markers. So there's an example there on the slide. So basically at the beginning of the project, when you're looking at those areas of, would define for each area of change, you define what you expect to see change. So 0% situation as it is at the beginning. 25% change would be seeing some general trends towards the change. 50% would be a change that we would expect to see. It's not a difficult change. It's something that we think would be fairly easy to achieve. 75% would be something that's a little bit more ambitious, what we would like to see happen, and at 100% it would be something that we'd love to see and is, very ambitious. So if you define, according to your area of change, these different percentage points, then when you're going through and tagging those statements, you can actually tag the statements to that percentage of change. And then you can say, for example, in a specific area, for women or for men, where are most people at? And you might see most people are at 50% or most people are at 100%. And then you can really tie that back into those overall changes you're looking for in the project. So obviously there's a lot there. It can be quite complex, that kind of analysis. It needs a lot of time, but that's in general how we would do it.
Okay, great. Victoria, there's so much there. I'd love the rolling profiles methodology. What I'm going to do though is keep triggering your thoughts for new ideas by moving on to hear from Lydia Powell about the light wheel. So if we can just switch across now, I'll give you a little background on Lydia so you understand where she's coming from. But essentially this is Tearfund's light wheel framework, which provides a holistic framework for tracking people's needs over time. Lydia Powell herself is part of Tearfund's impact and effectiveness team. So there she leads the development and scale up of Tearfund's light wheel tool. She supports Tearfund's staff and partners worldwide to embed the tool in their programming as a way to measure holistic impact. So there's lots for us, I think, to learn here in terms of embedding a new system and encouraging take-up. In a previous role, Lydia led the research and writing of Tearfund's annual Impact and Learning Report and the 50th anniversary Faith in Action research. And prior to that, Lydia studied a Master's in International Development at the University of Cambridge, so she's obviously very smart. Lydia, are you with us?
Hi, Neil. Yes, thanks. Hi, everyone.
Thank you for joining us. So I am really excited to hear and to share some of the stuff on the light wheel example. There's a lot there though, just like with the rolling profiles. So can you start with the sort of ABCs? Can you tell us a little bit about the journey that you've been on at Tearfund to develop the light wheel and some of the factors that prompted the design of that tool?
Yes, great. Thank you, Neil. So just some background for those of you who don't know Tearfund. We're a Christian relief and development agency, and we do community development, humanitarian relief and advocacy work in around 50 countries around the world. So the light wheel tool, which I'll explain a bit about today, is currently being used in our community development work. And we have been creating the light wheel, firstly to help us articulate the kind of transformation that we want to bring about through our programs, and secondly to help us capture evidence of that impact from a holistic perspective. So I'll give a bit of detail into both of those areas. So you can see here our vision at Tearfund is to see people freed from poverty, living transformed lives and reaching their God-given potential. And when we talk about seeing transformed lives, we're really thinking about that from a holistic sense, because for us, poverty is holistic and includes a range of dimensions, which we want to capture when we go about doing our M&E work as well. And many of those dimensions, for example, social aspects, emotional and mental aspects, the environment, spirituality, they can be less tangible and harder to capture in our monitoring and evaluation systems. So that really led to us as an impact and effectiveness team asking some tricky questions of ourselves. How can we go about communicating holistic transformation with our staff and partners in a more practical way? How can we design programs which aim to bring about this holistic change? And then even harder, how can we go about measuring and collecting high quality evidence to see if our work really is having a holistic impact? So with those questions in mind, some of my colleagues about 7 or 8 years ago started working with the University of Bath, who have specialists in human well-being, alongside some of our in-country staff members. And eventually, after grappling with lots of different elements, they came up and landed on 9 different dimensions, which they believe are essential to human well-being. And that became the framework which we now call the Light Wheel, which stands for Learning and Impact Guide to Holistic Transformation. So the Light Wheel is first and foremost a framework which helps us articulate what we believe holistic transformation or holistic well-being looks like. And then we've designed a set of participatory data collection tools which help us to measure impact and change in relation to those 9 spokes. So if you just click to the next slide for me. Yeah, so that you can see there in a bit more detail what those 9 dimensions are. So you can see that it's not only looking at some of those traditional elements like physical health and material assets, but we've also got in there elements such as social connections, participation and influence, mental well-being, living faith, stewardship of the environment. So at Tearfund, we would say that if we can see growth in those 9 areas, that's really what we're looking for when we talk about seeing whole life transformation and when we try and measure our impact from a holistic perspective. And just to add, the wheel shape was chosen to represent how all the different aspects of well-being are so interlinked. And for a community to be fully flourishing, we would want each of those spokes to be strengthened and functioning well. So it's really in the last sort of 2 or 3 years that we've been stepping up using the light wheel at Tearfund, and we're really on a journey to learn about its potential and how it works. And as I said, it's being used in a development setting at the moment.
Great, that's a really good background for us. It does raise questions in my mind about the practicalities. So could you talk us through how the process itself actually works?
Yes, great. So the light wheel has a maturity model that goes with it, and that's based on behavioural change theory and ranges from level 1, which is the weakest level, through to level 5, which is really an ideal situation. So the maturity model helps to paint a picture of what a typical community would look like as it journeys through from level 1 to level 5. And often we talk about a tipping point with our staff and partners from level 2 to level 3, with level 2 being a situation where communities are perhaps aware that things need to change, but they're not doing anything about it. And then level 3 is where we see communities taking the initiative and working with our staff and partners to bring about change. So we're often looking for that tipping point from a level 2 to a level 3, being that key kind of indication that things are moving in the right direction. And we try and make this maturity model as visual and creative as possible for communities to really understand and get to grips with it themselves. So you can see there the imagery of a blossoming flower, with level 1 being a dormant seed, through to level 5, which is a pollinating flower, which is sort of fully strengthened community. And if we can just go to the next slide, you'll see that the way in which the maturity model is scored is primarily through focus group discussion with the communities. So it's a very participatory model. And we work with our staff around the world and partners to try and contextualize the way in which communities score. So using the flower diagram, or using, you can see on the left there, a matrix diagram which was used, or scoring with stones on a ladder. So it is a very flexible tool that can be used in different ways depending on the context. And we're also working with country teams to design the focus group questions specifically for different contexts to really help communities understand what each spoke looks like for them in their context. If we can go to the next slide, you'll see that the focus group discussion is at the heart of the light wheel toolkit. And then we recommend for our staff and partners to triangulate the community self-assessment score with at least one other source of data, so they can start to develop a really deep picture of what's happening in the community in relation to the 9 spokes. So our household survey tool, direct observation tool, and secondary data tool are again based around the 9 holistic spokes. So yeah, hopefully that gives you a bit more of a picture of the different tools that we use to support the spokes.
It really does. Thank you, Lydia, for outlining all of that. It's quite fun seeing how a conceptual framework like this can actually be applied using a different range of different tools. So it would be great to get an idea now of how the light wheel is actually used. So how does it fit into the project cycle?
Yeah, sure. So yeah, as I mentioned, the light wheel is a flexible tool because at its core it is a framework that can be applied in different ways. And again, the toolkit can be applied in different ways depending on the resources and the needs that the team have, or that the project has. So just to give you some examples of how we're seeing it being applied, we're finding it a very effective way for communities to self-assess themselves during a needs assessment. You can see an image there taken from Guatemala, where a partner came to the end of a project cycle And they then went through quite intensive light wheel work with the community to help the community voice what their priorities were for the next phase of the project. So in that sense, it almost became like a decision-making tool for leading into program design. And what's really exciting is that we're hearing from communities that actually the light wheel isn't just a tool for measuring change, it can become a tool for change in itself when communities are given the chance to really have their voice heard, and also to think about what could the future be like by looking at the maturity model and thinking, actually, these are hidden issues that we haven't thought about voicing before or thought about reflecting on ourselves. So it actually becomes a tool for inspiring communities to start doing things and start dreaming for the future. And then we're seeing our programs using the light wheel to conduct baselines, looking at, you can see there the matrix diagram where you can see where are the community today in a holistic way, and then that can then be used and built upon for ongoing monitoring and impact evaluation. And then we're also seeing the framework be used in research as well. So, for example, we've just conducted some research in Rwanda looking at the experience of elderly people. And in that situation, they took the 9 light wheel spokes, but they applied a lens of looking at aging from the perspective of each of the 9 spokes. So hopefully that gives you a sense that the tool is so flexible and adaptable for different contexts and different needs. We're actually still on a journey to learn more about it.
Exactly, it's that flexibility that I think is quite
Yeah.
exciting about it. And I mean, it raises all sorts of questions about how it could be applied in different ways within different organizations and how it could be adapted to different contexts.
Absolutely.
Really exciting stuff. I guess the last point then is just reflecting back to some of the vague abstract themes of the Breaking the Mould paper that I outlined at the beginning of the webinar. Do you see any particular connections between the light wheel method and the 3 themes that I'd highlighted on timing, adaptiveness and perspectives?
Yeah, so I think the thing that first jumps out to me is the perspectives theme, because at the heart of the light wheel is the focus group discussion. We find, as I said, that really is a tool empowering for communities, not only to assess a program, but also to be involved in decision making. And when we use the different data collection methods, we find that different contrasting perspectives come out, looking at the difference between the focus group scores and then what people would say at a household level, and also trying to separate out community leaders into a group of their own, young people into a group of their own, so that different voices can be heard. And really the role of the facilitator is key in that, in generating a discussion that really does enable people to have an honest conversation. So we find that training facilitators is really, really key in that. And then on the timing theme, we often use the light wheel with a process that we call church and community mobilization, which is about mobilizing churches to work with their communities to do local level projects, development projects. And we see that very much as a process and a mindset change rather than a project with a clear beginning, middle and end. So in that sense, we need an evaluation tool that isn't just coming in at set points, but actually that can be drawn upon by the team or by the community whenever they feel it's appropriate to take stock and have those repeated reflection points, as you mentioned before, Neil. And because of the flexibility of the tool, it can really be adapted to fit the needs of the project and to be drawn upon whenever is relevant. And then on the adaptation one, I think the light wheel is a tool which really encourages adaptiveness in programs, linking to the point that it can be a very flexible tool and can be used to take stock at relevant moments. And also on the idea of doing no harm and looking at unintended consequences, I think it's really important that we continually kind of take a step back and check against the 9 spokes what's happening. And just to give an example, recently from Tanzania, they found that actually in every project where they did the light wheel, the stewardship of the environment spoke was continually getting worse, probably in a large part due to climate change, but also because the projects were focusing on livelihoods, people were actually going out and chopping down trees to sell charcoal. So they realized that actually they had to take stock and make a change to the program. And now their country strategy is focusing very heavily on environmental and economic sustainability. So the light wheel was a tool that really helped them to shine light on some of those hidden areas and adapt to their program.
Great. Thank you so much for sharing all of that. It's really, really powerful stuff. So just before we move on to the three-way discussion between the three of us, because I think there's lots of stuff that has come out of it, I actually just wanted to ping one of the questions that's come through from the participants directly to Victoria now, because there was a question from Diana Cartier, who's joining us. Hi, Diana. She wanted to know if you have several people from each profile that you interview over time when you're doing the rolling profiles methodology. And she also wanted to get a sense of who determines the progress markers. Is it done with the profiles of the people themselves, or is it by the team itself? Could you give us your thoughts on those questions?
Yeah, so thank you for those questions. It's good to clarify. So with the profiles, it's one profile for each person that we've selected to include as somebody that we'll interview. So then, like I said, it could be between 20 and 30 people that you've identified at the beginning of the project, and you go back to each of those people every 6 months. So each of those 30 profiles, I mean, there might be some people who drop out, but ideally, each of those 30 people, you'd have a set of profiles for them every 6 months. So by the end of the project, I mean, the development projects could be 4 years long, so you could end up with 8 profiles, for example, for each person. And then when it comes to the progress markers, it's done with the team. So it's usually done right at the beginning of the project, and it's going to be connected to that theory of change. So it's really about determining the pathways of change, and the team themselves will be defining what change they expect to see along those pathways.
Great, that makes a lot of sense. So we have lots of questions that we want to sort of discuss right now between the three of us. There's a bunch of issues and some learning on the biggest challenges that we faced and how we could apply it to individual settings. Just a quick question, Lydia, if you don't mind, before we move on to the broader discussion, there was a very specific question, I think, of clarification on the light wheel approach. So
Yeah.
specifically looking to know if all that sort of holistic information, it's very wide-ranging information that you're gathering. Are you transferring that into quant or to qual data? How do you kind of navigate the two? Is it mixed method? What's the situation there? So that question came through from Maya Zahabi.
Thank you. Yes, good question. It really depends on the methodology being used by the program. As I said, it's quite a flexible tool that different tools can be drawn on. But with the focus group discussion, you have the scores given by the community, but actually an area we're looking to develop more on is how we can really benefit from the rich data that comes from the focus group discussion transcripts. And one thing that we've been experimenting with in Tanzania is using a method called qualitative network analysis. I believe that's what it's called, yeah. Which is looking to code key themes against each of the 9 light wheel spokes and looking at the amount of times participants are mentioning certain themes against the spokes and then turning that qualitative data into a more quantitative analysis. So we're looking at exploring that further. And then with the household survey, we have a set of light wheel indicators which the survey helps to answer. So if you do want a more objective comparison to the focus group discussions, you can also go down that road of having the indicators and analysing the household survey. But that does require slightly more level of technical ability. So it really depends on the resources and the capacity in the team.
Sure. Great, that makes a lot of sense, and I think it speaks to the flexibility of that model as well. So if I could just move on now, because there are more questions coming through, but I think we can save them for the open Q&A afterwards. I just wanted to get a couple of broader questions through to you both now. So you've both given really good examples of tools that you have actually trialed, and they're new tools, there's innovation going on in your organizations. So I guess the question I'd like to put to both of you is really, what are the biggest challenges that you feel you faced in getting that stuff done, in breaking through and innovating? So if I could pass that question first to Victoria, and then afterwards we'll follow on with Lydia's thoughts.
Yeah, so I think there are kind of 4 key areas where we see challenges. Firstly, I've said there are limitations around how we do the sense making of that data that we've analysed and apply that in decision making and making adaptations, which is obviously key. So one of the issues here is that I've been looking back at previous projects that have used this approach, and I found lots of analysis reports which show all of this very rich, interesting analysis using that data from the rolling profiles. But what I can't find documented is if that led to changes and action points and program adaptations, which it likely might have done, but that hasn't been documented. And what I've seen in the current development projects who are using this approach is that it's much more linked to reporting, and the data that's coming out, the analysis is being used more for feeding donor reports rather than feeding into decision making, which is obviously a huge important aspect that needs to be applied. And I think that really comes down to having that buy-in from the teams, making sure that the analysis is conducted in a timely way, because as you've seen, it's quite in-depth, so that it can feed into decision making. Another challenge that I've seen is that because those domains of change are so clearly structured, it seems to in some cases kind of limit the extent to which people are looking for unexpected changes or unintended consequences, negative changes, and also changes in needs as well. So I think in some of the write-up that we see, when you see the full profile written up longhand, you can see that some areas of negative change was coming out, but it wasn't probed by the person who was doing the interview. So I think it links a little bit to challenges in capacity as well. So obviously, we all know that qualitative data collection is difficult. We often train our teams on conducting surveys, which is obviously a completely different approach. We also see sometimes that senior management don't have as much buy-in for qualitative data. It's not so easy to understand or to know what to do with it. And we've also see a kind of challenge around the trust element, because it's a methodology that was developed at headquarters. And headquarters asking field staff to please tell us what's going wrong and where you've seen negative changes or unintended consequences. Sometimes people might not feel comfortable to be highlighting those issues and are kind of preferring to highlight what's going well. So that's a little bit of a gap there, I think. Also, some of the areas of change that we're looking at, especially, for example, when it comes to gender, these are things that for all of us, and including staff on the ground, these are areas that relate to our own perspectives on things. So if we're not supporting staff, what the kind of gender changes are that we want to see in the project, and making sure that we're also giving them that kind of support and understanding, then there's always that risk that they could bring in bias around their perspectives. So really, like, the time investment is a really key aspect that we've seen. If that's not, if a time investment is not made, then it can really undermine how useful the methodology can be. It's time for building capacity, for undertaking that analysis, and then making sure that you've got space for the sense making. And we really think that a big input of time at the beginning is really important, but then also all the way through that cycle, and refreshing every 6 months is really key. So it really does mean it does need a lot of a high level of commitment to make it work. So I think those are really the key challenges.
Great, yeah, very clear, and unsurprising a little bit, I think, but it's interesting to hear those challenges from a particular case study. So Lydia, what are your thoughts on the biggest challenges you faced?
So I think for us, some of the biggest challenges have come from when we've tried to share this tool with our local staff and partners. And what we're really trying to do is turn it into something that really resonates with them and is easy for them to use, or easy enough for them to use. So one of the ways that we're working on that is trying to make the tools as simple as possible. To begin with, the tools were very text heavy and required quite a good level of literacy. So we're working to try and simplify the level of reading required, looking at how we can make the tools more visual, the concept more visual, and give more guidelines around the analysis, so that it really does resonate with our local staff and partners. And linked closely to that is the contextualization that we're trying to do, so that we keep the architecture of the light wheel the same, with the 9 spokes, the maturity model, and the tools, but we work to help our staff and partners to contextualize the questions, to contextualize the way that they talk to the community about the levels 1 to 5, so that they really feel like they own the toolkit, and it's something that really resonates when they go out and talk to local communities. The other area that we're working to develop is the fact that the tool was initially written with a Christian majority context in mind. So we're really grappling with how we look at the role of faith more broadly within the tool, and also how we can apply it into fragile states or humanitarian settings. So that's something that we're really interested in. And then the fourth point there, just looking at how it fits with a really joined up approach with M&E, because it's clear to us at the moment how it works in terms of need assessment and baseline and evaluation, and we're trying to join up the gaps in a sense and look at how we can use it for ongoing monitoring, so that it's a framework that runs throughout the whole project cycle.
Okay, makes a lot of sense. So then if I can ping the next question back to you, Lydia. You've outlined the challenges quite neatly there, but what was the biggest learning that you had when it came to introducing this new tool? What, overcoming the challenges, what do you think contributed to the success of it?
Yeah. So again, I think linking with so wherever possible, Tearfund works through local partners on the ground. So I think working with them to listen to their needs around monitoring and evaluation, so that they felt that this was a tool that was for them, that it wasn't coming from Tearfund down to them, that actually we listened to them and we could help them design and adapt the tool so that it really fitted for what they wanted and the gaps and challenges that they had. And a big part of that was inviting them to join us in the contextualization. And they really felt like they came to kind of own the tool, and they're really driving it in lots of different countries now, which is really exciting. So those 2 points kind of linked together. And I think investing in the training of facilitators and enumerators is key, and it does take time and money. But for them to really understand the 9 light wheel spokes is essential in order for them to be able to guide the community through that process of scoring in a way that feels natural, in a way that includes lots of different voices, and in a way that gives a genuine score, because sometimes it can be hard to get communities to score themselves genuinely. Often they can be over generous. So yeah, the facilitator is key, and having those structures in place with in-country M&E staff who are bought into the tool and really understand it, has been key as well. So those are just some of the takeaways that I'm reflecting on at the moment.
Yeah, that makes a lot of sense, and there's a lot there. So just to move on to the third question before we open it up a little bit, I'd be keen to know, given all the learning that you've both shared, and given the challenges that you've seen and the solutions that you've found, what do you think, the two of you, about the challenge of how to apply this stuff to humanitarian settings? So if I can pass first to Victoria to hear your thoughts on that, that'd be great.
Yeah, so obviously this is something that I'm really interested in. I think that we need to do better at getting qualitative data in work, and we tend to rely a bit too much on the quantitative side. So I'm really excited about thinking how we could use this in some of our humanitarian projects. We do have some projects which are multi-year projects, 2 or 3 years. So I think, there would be time to include the rolling profile in those projects, but it needs to be stable, obviously, because you want to go back to the same people again and again. So it's about targeting this approach only in those contexts which are stable and where you're going to have a specific project, or maybe overall. I think that obviously in humanitarian programming, we're not looking for such ambitious transformation and change that they are on the development side, but we are still looking for some changes. It might be around WASH practices, it might be around attitudes to gender-based violence or sexual reproductive health. In CARE, we look around some changes in gender. So I think it's still relevant to look at, trying to monitor that change. But also in humanitarian, we need to make sure that we can make it broader to focus on those unexpected changes, negative change, and also to capture changing needs, which is something that on the development side haven't been focused on so much, and also potential barriers that we're seeing to our programming. So it's definitely crucial to have that aspect in there. I'm also thinking that in humanitarian context, this idea of working, not just including the beneficiaries as participants, but also collecting data from other stakeholders in the project is it's coming into capturing those different perspectives that you were talking about, Neil. And in humanitarian context, we might see, many variations in perspectives. So what if we included volunteers and our local partner staff as participants? There's obviously these people are like a source of rich information around what's changing on the ground and what's changing for them personally, who are often responsible for delivering a lot of our programming. And it's kind of information that's captured informally. But if we capture it as part of this methodology, it would be analyzed and put into a system and, looked at by senior management decision making and kind of validated in that way. So I think that could be really exciting. And then finally, again, in humanitarian context, we can see a lot of discrepancy between perspectives. And obviously, this is from a limited set of participants. It's a very small sample, so we really need to integrate it in a strong meal system so it can be triangulated with other sources of data and build it into that regular cycle of reviewing data and thinking around adaptations. So I think it's really key that we're not just focusing on this, but in triangulating it with other sources of data. So these are the things I'm going to be looking at in my work moving forward, seeing if I can adapt it.
Sounds great. I think we should watch this space a little bit. Maybe we could touch back with you 6 months' time, see how progress has been made. For now, though, let's hand over to Lydia. Your thoughts, Lydia, on applications of the light wheel approach to humanitarian settings.
Yes, thanks. So there are several opportunities that have come to my mind in terms of application of the light wheel to humanitarian context, but it's not something we've explored at Tearfund yet, but it is something we would be interested in. So just to add, if anyone is interested in applying it to or having a go at applying it in a humanitarian context, that's something we're really keen to explore. So yeah, just for me, a few opportunities and then a few questions really back out to the floor. I think some of the opportunities are how the light wheel's strength is in looking at needs from a really holistic perspective. So I think that would definitely be a benefit in a humanitarian response setting, and potentially bridging the gap from going from an immediate response into then recovery and rehabilitation, and thinking about potentially whether some of the light wheel spokes are most relevant in the initial response, and then perhaps some of the other spokes come into play later on. So using the tool to kind of recognize the individual as a whole being, and then thinking about, well, over time, how can we start to bring in these different dimensions or work with other organizations to bring in different dimensions. So having that really holistic perspective. And also the ability to use the light wheel to explore potentially unintended outcomes and ensuring that our work isn't having a detrimental effect in other areas that we perhaps don't intend it to. And I think the fact that the light wheel is so focused on participation of beneficiaries could only be a strength in terms of humanitarian application as well. And that's feedback we've had about how the light wheel can be a tool for helping people have a vision for the future and to think about how they can articulate their primary needs, I think would be a real strength. And again, the flexibility of the light wheel and the fact that we are seeing it being used in different contexts and given kind of different thematic lenses, as I said, with the aging work that we've been doing. So I think there is real potential that the light wheel could be adapted to a different context in a humanitarian setting. I think that links to some of the questions I had about potentially how the light wheel would have to be changed, and whether there are any thoughts in the audience about how the light wheel would have to be changed in that context. I think one of the things is, are all the spokes relevant? Can we expect to be touching these 9 different domains in a humanitarian response? Or, as I said, is it more about having a joined up response as we move through the stages of response, bringing in different spokes? And then the maturity model, would that have to change in terms of what we mean by level 1 to level 5? Obviously, that's different in a development context compared with a humanitarian context. So how would that work? Thirdly, the point I raised before about the tools being quite resource heavy and quite lengthy, particularly if you're working with moving communities or transient communities. If it's a long process, it might be hard to get to talk to the same people over a prolonged period to see change. So perhaps its strength would be in the needs assessment phase. But I think there is a lot of potential for how the tool could be used in this area. So really keen to hear people's thoughts on that.
Great. Thank you both for answering those questions. We have lots of questions coming through from the audience now. So I think what we should do is start off by just touching on some of the questions that came through during registration. There are a couple of questions there that I think are linked neatly to what we've been discussing. But then I'll also pass over to some of the questions that have been coming in whilst we speak. So if I can just kick off myself, one of the questions that came through during registration was from Alexei Grinov from NRC. Alexei asked if there are any nuances that need to be taken into account when developing theories of change for integrated programming. So this is a slightly different topic from the, directly what we've been discussing, but I think it's just worth flagging for Alexei and also for our other listeners that the Danish Red Cross did a recent study on looking back on 10 years of their integrated programming, and they developed a kind of integrated programming guide. And just to answer that question, I think it's worth looking into that study and the associated guide, because it's quite interesting. So there we're talking about holistic programming that covers multiple different sectors. So it's, it's a little bit like the conceptualization of the rolling profiles and the light wheel. But for the Danish Red Cross's example, that was linked to work that supported community resilience at community, household, and individual levels, and it touched upon quite a wide range of different sectors. So it's really important work, and I think that Alexei is right to ask about how you design theories of change for such wide, all-encompassing integrated programs like that. It's always hard to capture everything. And I think the examples in that report show how expansive integrated programming can be. So my personal thoughts on this, just briefly, are that the theories of change that you use for an approach like that need to reflect higher level outcomes. So in terms of things like, for example, coping strategies. The purpose of saying that is to allow project teams to assess effectiveness at the global level rather than getting bogged down into sectoral divisions between different aspects of their program. But I think it's just worth remembering, the reason why I brought up this question is that it's an interesting example here, and it sort of speaks a little bit to Lydia's example with the light wheel, where I think you're developing an approach that helps M&E teams to explore holistic data collection rather than going into a sectoral lens. So it's just worth remembering that there are other approaches out there, and we touched on some of that in the paper, but I think there are other papers that are worth looking at in that regard. Another question that came through, I'm just going to be very brief on, was third-party monitoring. So Ali Buzurukov from the UN asked about third-party monitoring arrangements in Yemen. It's worth touching on that because it is obviously an example of innovation. We didn't go into it in detail in the Breaking the Mould report because it wasn't quite what we were looking at in that case. But I think it's worth saying that in that case, third-party monitoring is something that ALNAP will be continuing to watch in the coming years. I think on the one hand, it provides potential means for overcoming some of the challenges that traditional monitoring systems are faced with, but on the other, there's a distancing in theory between the monitoring teams and the project teams, which could theoretically raise questions about the loss of information in the cracks between them. So there's questions there about usability and uptake of information. So I think from my perspective, having published the Breaking the Mould piece, third-party monitoring is something that we want to watch as it develops over the next few years, just to see how it develops and what we think can improve potential learning outcomes if necessary. There's another question that came through that I'm going to pass to Victoria. I think it's a great question. It's quite pertinent to our discussion. So George Ebulu from DRC was asking for any examples of how to flex M&E systems in rapidly changing contexts, such as the Horn of Africa. Victoria, have you got any examples or experiences in that line of thought?
Yeah, so I wanted to just reflect on an experience I had working on the Syria response with an international NGO. And this was back in 2013, 2014. So when I started working with them, they'd already developed this approach, which was to basically have 3 different standards in terms of how they classified the different areas they were working in terms of security and access, but that also impacted on how they to do the M&E. So they classified it as gold, silver, and bronze, and the gold areas were areas where they had full access for national staff from the international organization. They could go in, spend as much time as they needed to, do as much monitoring as they wanted to, for example. The silver areas were a bit more insecure, only partner staff could access, or there could be intermittent access for the INGO staff to get in, and then the bronze areas, excuse me, were the areas where there is absolutely no access for the INGO. Very, very insecure partners couldn't spend very much time there. So the idea was that the monitoring system is kind of designed at different levels for those different areas. So as one example, for example, post-distribution monitoring, if you were doing it in a gold area, you could do a full PDM survey. The INGO staff could go in and do that. They could target 15% of the beneficiaries. If it was a silver area, they might be able to go in and do spot checks, but the partner would have to lead the PDM. They could only do it for 5% of the people that they targeted, and the survey would be cut down to be much shorter. And then if you're in a bronze area, they would try to do a survey by phone because it was, very dangerous to go in. But the phone network might not always work, so it might not always be possible to get PDM data from those areas. So it was really kind of practical, realistic, and prioritizing, safety for staff and the reality of working in conflict areas. And then that was linked to the risk matrix for designing programmings, so that senior management could understand if you are going to program in a bronze area, you may not have access to any monitoring data. So you might not know what's happening with the assistance that you're providing, whether it's going to the right people, how it's being used, for example, and whether they could think about whether certain donors would be okay with that level of risk, whether they're okay with that level of risk, and really think around what's necessary for programming and what's ethical and appropriate. And so obviously the different areas that you're working in, as the situation changes, particularly with conflict and that kind of insecurity, you can change an area from being a bronze zone, and then your monitoring system, is flexible to adapt to that, and in advance you've already defined what you will be doing. I mean, the same thing was applied to all the different aspects of meal. So the feedback mechanism as well, it was a different approach in the different areas, and then you just had to adapt it, and obviously speaking with the security colleagues, understanding how things were changing and linking it within that. So I thought that was quite a useful example of how to make things flexible and be adaptive, but also thinking beforehand and designing that, in a really purposeful way, so that you have those different approaches ready to go as things change.
Yeah, it is interesting. The mixture of preparedness and flexibility in that example is quite nice. So yeah, thanks for sharing that example. It does make me think, and it's a shameless plug perhaps, but of my colleague Alice Brecht's paper on shifting mindsets, which looks at flexibility in humanitarian action. So I would add to Victoria's point there, there's a lot of examples in that paper that Alice found, interesting examples and discussions around how monitoring and evaluation systems can potentially adapt during project implementation. And she looks at some of the challenges around doing that as well. So I would definitely recommend looking at that as well. If I can just come back now with one of the questions that came in from the audience whilst we were speaking. It was a question that I think is directed towards Lydia on the light wheel. It's from Linda, who asks the following question. You've got 9 spokes of the wheel, all reflecting qualitative transformation in the lives of people affected by crisis. Linda's keen to know how you tackle the risk of subjective interpretation along those different dimensions. Are there any kind of parameters or measurements within the 9 areas that you use to guide the evaluation and ensure, I don't know how to phrase it best, but to ensure a minimum sort of subjectivity if possible in the measurement of those aspects? Over to you.
Yeah, that's a really good question, and it's something that definitely comes up when we're doing the trainings and the contextualizations. I think having the maturity model, and if it's used well in the focus group discussions, that should be a useful anchor to help the facilitator and the community think through together where they really are in terms of progress, and it gives quite a detailed description which the facilitator will talk through with the community. And I think the key is to really ask back to the community if they say, right, well, we feel we're a level 3, to say, well, why is that? What evidence can you give? What examples can you give of being at that level? And then generating a discussion back within the focus group. And often those focus group discussions can go on for a long time as they go back and forth and say, oh, no, we think we're level 2, we're level 3, and reaching consensus. And then I think that's where the triangulation of the data comes in as well. So we really recommend for programs to use at least one other source of data against the community's own self-assessment score. And that's particularly where the household survey can really help to give you some more objective data against the indicators. So, you know, if the community is scored level 4 for physical health, and yet their indicators are coming back much lower, that's where, as a project team, you can generate a really rich discussion about why it is that the community is scored at a different level. So yeah, there's things that we do, but that is a very good question and a challenge that we are trying to face into.
Yeah, it's interesting. It's an interesting response you've got there. So that's a good comment on the specificities of the light wheel. We have a question here that I think touches on both the rolling profiles and the light wheel. And it's from Marta Bruno at FAO. She would like to know if you have any examples of how these different approaches empower communities and groups on the ground to better negotiate the design of activities and programs, or any examples of whether they're used by individuals on the ground to change their livelihood strategies. I think that's a really hard question, Marta. I'm glad you asked it. Victoria, do you have any thoughts on that question?
Yeah, that's really interesting question. And I think the idea with the rolling profiles is that by speaking to people and trying to understand, you know, what's changed for them and what hasn't changed, is that we're getting a better understanding of, you know, the impact of our project and the effect that it's having on people. And then by speaking to them and getting that understanding and really getting that in-depth understanding that doesn't come out, you know, from quantitative data, trying to understand all the different factors that are affecting them, all of the factors that our project is interacting with within the context. The idea is that we can then analyze and use that information to make changes to improve what we're doing. So I guess the idea would be that it would be through that process that we would be feeding that into adaptations and changing design, rather than directly involving those people in working with us on the design. It would be kind of using that data and taking that analysis, doing the analysis with all of that information. And I guess the idea there is that the strength of the approach is that we're getting all of those different perspectives, speaking to all the different stakeholders and really trying to get that holistic picture of what's happening and what different roles different people are playing and what's working and what's not working and where we need to adapt. But as I mentioned before, this is really the tricky part of the tool, is making sure that the analysis is done on time so that we can feed into making those adaptations. But the idea is that by having this qualitative in-depth approach, we'll have a richer understanding of what needs to change and what we need to do better.
Right, that makes sense. And Lydia, do you have any thoughts on Marta's question? So examples of how it's encouraged and empowered communities and groups on the ground to negotiate better design of activities, and whether it's been used by individuals to change their livelihood strategies.
Yeah, so 2 examples come to mind, which I'll share quickly. I mentioned earlier in Guatemala, where the partner came to the end of a project phase and they did an intensive light wheel analysis with the community. And through that process, the community identified 3 key priorities, which were then taken forward into the design of the next phase of the program. So that's a really tangible example of the community actually being involved as co-creators in the program design. Based on the light wheel process. And it was really interesting to hear that the partner then gave the information back to the community, because they had so much data collected through the surveys and through the focus groups. And I believe the community leaders were planning to take that data to the local government and say, look, you know, this is where we're at and this is where we want to improve. Where can you help us? And Tearfund is integrating advocacy training into our church and community mobilization work. So that was a really exciting example. And then again, in Tanzania, I mentioned how through doing the light wheel analysis, they saw how livelihoods training or livelihoods kind of mobilization was encouraging companies in that area, but there wasn't the training around environmental stewardship at the same time, and they saw that spoke was decreasing over time. So that led to a shift in the program. And an emphasis on setting up self-help groups, which are like savings groups, through our church and community mobilization work, And alongside saving money each month, they do training around economic and environmental sustainability, linking in with their livelihoods. So that's where we've seen a change in strategy thanks to the light wheel process. So yeah, hopefully 2 examples which connect in with the question.
Yes, brilliant. Nice response to Marta's question. I think there's only one question left to touch on, which I'll just briefly touch on. It's slightly to one side from the specific examples that we discussed there, but it definitely touches on the core question of innovating and being purposeful in our design of M&E systems so that we can encourage use and learning rather than just ritualistic application. So the question came in from Syed Kamal from Afghanistan. Syed asked if there's any way we can do a comparison between DAC and CHS criteria, and whether it's possible to adapt one to make it easy for both M&E folk and also project stakeholders. So this question I'm classifying as an oldie but a goodie. I think it's one that's as old as the DAC criteria for sure. I would say, broadly speaking, that formal sets of criteria like DAC and CHS have a pivotal role to play when it comes to assessing humanitarian action. But Syed is quite right that sometimes it's hard to get traction around a report that's based on those types of criteria, especially amongst key project groups, stakeholder groups. So again, this is a plug, but Syed, I would strongly recommend you take a look at the ALNAP EHA guide, the Evaluation of Humanitarian Action Guide, which looks at that issue in some detail. And the core recommendation there is to start with a stakeholder analysis before designing the questions, identifying the information needs of your key stakeholder groups, and then designing your questions off the back of that. And only then looking back across the different criteria to check if all the right areas that you need are covered. To emphasize, we're certainly saying use those criteria, certainly, but the point is to make sure that the information needs of your core stakeholder groups are the focus of your M&E system and not the other way around. So Lydia and Victoria, thank you so much for your interventions. I think you've shared a great deal with the audience, so it's been really good learning from you. Can I just check in with you if you've got any other burning issues you wanted to get across to the audience before I wrap up?
No, I was just going to say thank you so much for the opportunity, and yeah, I think it's really key that we keep talking about these issues. And as you mentioned about how we use data and apply it in decision making, this is really the key focus for us as meal people, and it's the ongoing challenge that we deal with.
Yeah, great. And yourself, Lydia?
Yeah, just to reiterate that, thank you for inviting me to participate today. And if anyone is interested in finding out more about the light wheel on the light wheel tools, they're all available for free on Tearfund Learn, which is our website, tearfund.learn.org, or yeah, do get in touch. And I think our email address is in the slide deck. So yeah, thanks.
Perfect. So thank you to you both. I think your contributions have been fantastic, and it's been really exciting hearing about the rolling profiles and the light wheel methodology. I do mean it when I said earlier that it would be nice to check back with you guys in 6 months' time. I think it would be good to get a blog out about how progress has happened and whether applications to humanitarian contexts are possible. But just to wrap up, thank you to everybody. Thank you for our presenters. Thank you to our participants, and thank you to those who put forward questions. I want to just make it clear to everybody that the video from this webinar is going to be available on the ALNAP website in the new year. So you'll have to wait over Christmas. You can't watch it on Boxing Day, but you can watch it in the new year. And so therefore you'll get links to everybody's resources, and you'll be able to follow up from that point. And just briefly, I would say to the entire audience, I'm keen to follow up on this Breaking the Mould paper with examples of initiatives that have taken this kind of stuff forward. So open invite. If you have any examples that you think, hey, this should have been in the webinar, send it through to me. I would be very keen to profile that stuff to get an understanding of how you've dealt with the challenges that we've been talking about here today, and how you think we can move forward in the future. Keep an eye, lastly, just keep an eye on the ALNAP website. There's lots of work coming out on monitoring and evaluation shortly. We have some work on evaluation synthesis. We will have some work on issues and challenges around evaluating cash programs. And then as we move into the next financial year, there's going to be a whole bunch of new stuff coming out. So I would encourage you to keep an eye on that, because there should be some fresh activity next year. Apart from that, I think that's it. So thank you everybody for your time. I hope you have a wonderful afternoon or morning or evening, depending on where you are. And I look forward to hearing from you. Thank you. Goodbye.